Moving on, the death toll across Africa remains much lower than in Europe or the US, but health experts are nevertheless concerned about how this pandemic could affect the world's poorest continent. South Africa has the highest number of detected infections in sub-Saharan Africa, with the health ministry there reporting the country's first 2 fatalities. The 57 million people who make up the population there are now living under a 21-day lockdown, with citizens banned from going for a run, walking their dog or purchasing alcohol. Earlier, I spoke to Jane Flanagan in Cape Town. This is what she had to say about what the future for South Africans looks like.
South Africa is one of the world's most divided and unequal societies. So, of course, the experience of this lockdown, which is possibly one of the strictest measures imposed in Africa, is going to be very different. For the majority of South Africans, it's going to be painful. They live very hand-to-mouth. They rely on the informal economy, which is going to be absolutely obliterated during this lockdown. And of course, the majority of South Africans are living in poverty. Just up the road from me in the township, it's unimaginable how people can practice social distancing or self-isolate if they display symptoms. When people are living so cheek by jowl, families living in one room, large numbers of families sharing ablution facilities and queuing at a standpipe for water. For the minority of people, it's going to be inconvenient, but it's going to be doable. Those of us who have a comfortable house, can work from home, it's going to be inconvenient, but it's going to be, it's something we can tolerate.